Thanks for staying with us. Now, long COVID is a term used to describe the effects of COVID-19 that continue for weeks or months beyond the initial illness. Many people feel better in a few days or weeks after contracting COVID, and most will make a full recovery within 12 weeks. But for some people, symptoms can last longer. The people it affects, who sometimes call themselves long haulers, experience either flare-ups or continuous symptoms of illness. Tonight, I'll be talking to Wachuka Gichohi, who will walk us through her journey with long COVID. Wachuka is an entrepreneur, co-founder, and COO of Ikigai Nairobi. I'll also be talking to Dr. Shenal Shah. Dr. Shenal is an international award-winning specialist in integrative and functional medicine, an approach that marries Western and Eastern medicine to help chronic conditions. She has trained in Cardiff University and Harvard and been in practice in Kenya for over 7 years. I'll start with you, Wachuka, and many thanks for sharing your story with us. Let's start with your personal experiences with long COVID. What symptoms did you experience and for how long?
So my journey started about a year ago in March last year after a trip to the Netherlands. After I got back to Nairobi a couple of days later, I started to experience chest pain, sore throat, acid reflux, migraines, and body aches. So I immediately rushed to my GP. He put me on antibiotics, which didn't help. And that kind of went on for about 3 weeks. And then after that, I kind of, started feeling like I was coming out of the woods, which to me was an indication that I could jump back into work and exercise. But what followed was a horrible relapse in month 3, which was in May. And the journey basically started from there, where I struggled with about 80 different symptoms that went on for months and months. Those symptoms included things like several neurological symptoms, so memory loss, trouble concentrating, trouble understanding information, migraines that were completely blinding. I had hallucinations, buzzing noises in my head and ears, blurry vision. I had brain fog as well and trouble with my hand-eye coordination, so I was easily dropping things and breaking things. I would write things down and then, a few days later come back and I couldn't understand what I had written, and that's still happening until today. And then really bad nerve pain, which just felt like my body was, on fire from under my skin, which was really, really paralyzing. I also had heart issues, heart palpitations and pain, chest issues, shortness of breath, stomach issues, insomnia, panic attacks as well. Fatigue was really severe, and this is one that a lot of long haulers struggle with a lot. So I couldn't brush my teeth or walk around the house or shower. That has gone on up to now, but I think has subsided a little bit. I have a histamine intolerance, so I'm now allergic to a lot of foods and drinks. Muscle and joint issues as well, exercise intolerance, so I can't do much exercise, or it just sends me back to square one. And basically I found that it had affected my lungs, my heart, my central nervous system as well, my muscles and joints, thyroid. My blood got really thick and sticky, so it was easily clotting. And yeah, it just felt like the virus had kind of completely taken control of my body, and it was really traumatic.
And Wachuka, I came across a Facebook post where you detailed your journey 1 year into this. Are you feeling any better? Have the symptoms subsided?
Yes, I would say I'm about at 70% in my healing journey in terms of how I'm feeling. I'm having some symptoms that have remained for the entire time. Some have gone away. Some come and go. So you really don't know what you're going to be faced with the next day. You just wake up and you wait, and hope that you don't have any. But I have had more days of relief. The relapses are a little bit shorter now. But I think the struggle now remains, that the world still doesn't know how to treat this. So you end up having to be the patient and also the doctor and the researcher, and you have to advocate for yourself and you have to support others. And it becomes a very heavy load to carry. And yeah, it's still a daily struggle, I would say. It really takes a lot out of you.
Talking about treatment, what medication have you been on?
So aside from antibiotics that I was given right at the beginning by my GP, I haven't taken any other conventional medication. I decided to go the integrative medicine route, and I'm really glad I did, because I find that it's a route that's helping a lot of COVID patients, because it's a disease that has so many different layers and dimensions that you need a more sort of holistic and systems-based approach to healing. So that's the route that I took. So it's mainly about, supplements, alternative therapies, like, going to a chiropractor, meditation, psychotherapy, Chinese herbs and Ayurvedic herbs, peptide injections. So it's really just sort of an integrative approach.
Mentally, and the mental outcome of this journey for you psychologically, what was the impact of all of this?
It's been huge, and I think as it goes on for longer, I think it takes more and more of a toll. Of course, like I mentioned, it's had huge neurological effects for me, so that's been quite difficult, not having a brain that functions the way you're used to it functioning, but also just going through depression and mood issues, severe anxiety and panic attacks. I've developed pretty severe PTSD to the point where, my body now sometimes does not allow me to go to sleep. It just keeps me up, and I can go days and days without sleeping properly. So it takes a big toll. I've spoken to a lot of people that have ended up getting to a point where they're suicidal, and they just can't deal with it. So it's really tough. It's tough, yeah.
And you've been sharing your journey online, like I previously mentioned,
Yeah.
Wachuka. Have people who have experienced the same reached out? What has been the reaction from strangers, family, people
Yeah.
who might know, and who might just come across your posts like I did? What has
Yeah.
been the reaction to your story?
It's been great. For a long time, I was too scared to share it, which I think is a thing that some long haulers are struggling with, and that's why we haven't seen so many coming out and talking about their experiences. But when I did eventually sort of have the courage to do it, I got a lot of people just writing, messages of support in Kenya and also abroad, and a couple of long haulers in Kenya that reached out and asked for some help and support, and just to know that somebody else is going through it, because it's a very lonely and scary illness. And I think here the stigma has really prevented a lot of people from coming out and talking about it. Yeah.
And before I get to Dr. Shenal, what advice would you give anyone who has come across your story, who can relate to what you've experienced? I posted about your coming on the show tonight, and a lot of people could relate to what I was saying in that post about long COVID. But in terms of people who are listening to you tonight, who can relate to what you're saying, what would you like to say to them?
Well, I'd like to first just say that long COVID is not an illness that only affects the elderly, which is, I think, a misconception that is out there. It is a disease that is affecting middle-aged people like me, and the majority of long haulers are actually middle-aged, and a big percentage are actually women. So it's people who are fit and healthy and young and high functioning. There are professional athletes like NBA players that are going through this. So for people that are sort of, my age and are going through this, they should know that it is real and that they should take it seriously. I would suggest looking for support channels because it is such a lonely process. I think finding support online on Facebook groups like I've done would be really helpful. And this week I set up a long COVID support group for Kenya. So I'm hoping that, from this forum, I'll get more people willing to join and also share their stories and learn from each other as well in a safe space. And also, if you find that you're having a doctor that's not supporting you, I suggest, change doctors, find someone who's going to listen and take it seriously, because that's a really big part of the journey as well. Yeah.
Right. Thanks for that, Wachuka. Let me cross over now to Dr. Shenal Shah. Dr. Shenal, who is at risk from long COVID?
Thank you for the question, Lillian. So just as Wachuka was saying, I think it's really, really misunderstood. The long COVID is a really misunderstood concept. And from the data, we know that at least 1 in 3 people infected with COVID can develop the long-term symptoms. This is really concerning, but even more concerning than that is people with high levels of fitness, like Wachuka said, are developing. So athletes would obviously fall in this category. And we're finding that they're developing inflammation in the heart, in other parts like the CNS. So, as she said, middle-aged women, they really fall in this category, and this is what the studies have shown, as well as the elderly, but it's quite concerning that a younger group is being affected. So we definitely need more studies to ascertain what's going on, but it's affecting multiple organs in healthy individuals. In functional medicine, what we find is there's a common thread of triggers for many chronic viral infections. So that's where we start from, such as looking at mycotoxins, their exposure to heavy metals, the microbiome, that's our gut flora. And some of these things exist silently in the body. And so they give the appearance of perfect health, but they can have long-term consequences on our biology and our immunity.
Let's get into tips for managing the symptoms. So for the normal COVID situation, within 12 weeks, somebody should feel better, but we have situations where people are experiencing symptoms longer. So how to manage these symptoms?
Yeah, I think that's a really important question, and it's also dealing with prevention. And sadly, very few conversations have headed this way. It comes down to fundamentals in health. So testing your body, not just when it is sick, but also when it's optimally healthy. And that's healthcare rather than disease care. Even those who tested with acute COVID, they should start thinking about supporting their immune system right from the start. Right. And also get some professional help, I would say. There are tests to determine, the levels of your vitamins, your minerals, your inflammatory levels, your liver health. And then we go into more advanced testing like heavy metals, mycotoxins, bacterial flora. That's now where functional medicine comes in. Right. And these are the things that really predispose you to optimal cellular function.
And we're in a phase of vaccination in the country currently. And so even as people talk about the vaccine, the fears around it, why you should take it, and for those who opt out, why, can vaccination improve symptoms for people with long COVID?
I think it's really early to be able to tell that. There still needs to be a lot more research done in that topic. There might be some studies finding it can help, but at the end of the day, we need to look at that individual's immune system and see how it's responding to what it's being exposed to. And that includes a vaccine which can, lead to an immune response in the body.
Right, yeah. And on the issue of stigma, which Wachuka spoke about as well, there's already some mental stigma around COVID. And, with the long haulers now, those who have experienced long COVID, what about that? What's your perspective on this, and how can we help shape perspectives and views around this?
So, long COVID occurs over weeks and months after testing negative. And initially, just testing positive can be difficult to swallow, but finding out you may never recover, that's a completely different level of trauma. The data is continuously changing. So, for example, yesterday we found out that 1/3 of COVID-19 survivors are being diagnosed with brain or psychiatric disorders where there was no previous history of it. And many long COVID patients are already struggling with the physical symptoms, not to mention, the brain disorders that come with it, which Wachuka has, she's really gone through that very clearly. What I can say from an immune perspective is if there's a dysfunction at the cellular level, the virus continues to hide in the body, going undetected and affecting multiple organs. There's a theory that it can cause inflammation in multiple organs. And this is where I think we just need to look at it, from a different lens. So just going back to what we would do in functional medicine is, when we're faced with inflammation, that's the first step we look at in any condition. And balancing that inflammation is the core. It's the biology to support the body with the right food, the right environment, the right supplements. That's very key when it comes to managing, as Wachuka came, talked a little bit about.
Okay, and I thank you for your time. But as we close, your closing remarks from you, Dr. Shenal, support one can get for long COVID in terms of treatment, in terms of recovery. Your thoughts on this?
Yeah, so I'd say resilience is so key in our ever-changing environment. And, we need to look at, the next epidemic, the next pandemic. What are we doing to keep our bodies strong? And this is really, really important. Are you eating the right foods? Are you making sure that your inflammatory levels are low? Are you getting tested to stay healthy rather than sick? I think the problem is that we're exposed to so many toxins today. They directly affect our immune system. And they also reduce molecules like flavonoids in our environment. So flavonoids are antiviral and antibacterial, and they occur in food. But they also help us support, if we're taking a supplementation of zinc, they help support the passage of the zinc to the immune cells. That's known as an ionophore. So, these are things that we wouldn't see normally, and it's really important for the future of us and our children that we think about becoming more resilient.
Okay.
In fact,
Yes.
In fact, we've had hospital doctors come to us and talk about how to support their immune systems. And I think that's the bottom line. You really need to think about health care than just disease care. Because yes, I am, I will not say don't take the vaccine. It is important. But what about the next strain and the strain after that and after that? So isn't it better for us to be strong and healthy at the core?
Right, and Wachuka, as we close, we thank you so much for your time and indeed for agreeing to this interview. But in terms of support towards your recovery, do you feel that there is sufficient support here in the country? Do you feel that you got adequate support either from the health system, from family, as we close?
Family, definitely. I think they were very open to hearing what I was going through, and kind of taking it upon themselves to read as much as possible and see what other people were going through, and seeing that actually it is something that is happening and that many people are experiencing. In terms of the healthcare industry, I think obviously I mentioned my initial experience was not very good. But after that, of course, once I moved over to working with Dr. Shenal and the other sort of alternative medicine practitioners that I worked with, I think they've all been very helpful. So I think I'm also fortunate enough that that I have been able to seek out these kind of professionals. But for those who don't, I feel like that's where these support groups become really important, because there's a lot of information on there, and people are able to point you in the right direction if you are struggling and you don't know which way to go.
Many thanks for your time. Wachuka Gichohi and Dr. Shenal Shah speaking to us on the show tonight. We are back in just a bit.